Okay. Okay, guys. So welcome to this workshop. I'm so glad that you came, guys. Thank you very much. We appreciate your attendance today. So guys, today we're gonna review the essay. We're gonna talk a little bit about the essay. Then we're gonna talk about the sections, and we're gonna do an in-depth review. And at the end, we're gonna refresh a little bit into the essay basics. So go ahead. Okay, guys, so essays can be daunting. I know that, guys. I know you haven't done an essay in a long time, and this can be kind of fearing for you. But do not worry about it. Because for you, you are nurses, writing is going to be a daily task for you. This is not something that you're not going to do. Writing, you have to do your care plans every day. You have to report. You have to do electronic health records. So it's important that you are very clear, that you know how to communicate effectively and clear. And then you're already a critical thinker, right? So I remember during the first semester of nursing program, they told us like, oh, this is just for you to develop your critical thinker. The number one thing that you need to be a nurse is critical thinking. And this essay is all about critical thinking, right? These are controversial topics that you're gonna encounter in the health field. So you have to be a critical thinker and evaluate the situation. That you're already like a critical thinker, so you're gonna do it. So let's start with the outline review. So you have 7 sections, and each one of them specifies something very specific. We will review each one of them right now. So let's start with the introduction. So for the introduction, the only 2 things that you need is a general summary of your issue, and this is gonna show the data, like what is going on at this moment, how the issue is standing, and then you're gonna have a thesis statement. And usually for essays, a thesis statement declares your position, but in this situation, it does not declare your position. So it's not, right? You're not gonna put like nurses should support this. No, you're gonna leave it like ambiguous, like kind of like neutral, and we're gonna talk a little bit more about this in the essay review. Okay. Then we're gonna talk about the population affecting. And for this one, you need the description of the population that is affected by your topic and 2 Erickson stages. So remember, guys, 2 Erickson stages. So you're gonna describe the population that's being affected, and you're gonna choose, like, you're gonna give me like a complete profile. Have you done a profile before? A profile is just like describing the person or a people or a group. So in this case, you're gonna describe everything. You're gonna describe it by gender, age, culture, ethnicity, anything that is relevant to your topic, you're gonna put it and you're gonna describe it. So for example, let's say, right, should the papilloma virus vaccine be required for children? Who is the population affected in question? Children, right? But who else? Who else is affected by this?
The parents.
Parents, yes, their parents as well. So you have to think it like that. It's like everyone that is affected by it. Okay. Do you have any questions so far?
No.
No? Okay. So what if my issue affects everybody? You didn't have that question. But because everybody, like, this is a repeating question that comes like every semester. Like, what if my issue affects everybody? Then if your issue affects everybody, you have to focus, right? You have to be like, oh, you have to range. You have 2 options. You can do range or you can do concentration. From the range, it can be like from this age to this age, or the concentration is the most affected group. So you know, as nurses, that there are some groups of people that are more affected than others, right? Yes. So try to think about that. There's always one group over all of those that is the most affected. Okay. Then you have to do 2 Erickson stages. So you know the Erickson stages, right? You're familiar with them. You have seen them this first semester. So you're gonna do it. Remember, 2 minutes. Okay. So let's say, what if my issue involves everybody? We also have this question as well. You do the same thing. You do the range. It's from this stage to this stage. And you know how stages go by ages? So you remember, you need 2 stages. So make sure that you do that. Or do concentration, right? Describe the most affected groups, Erickson stages. Okay. Then we go into pros and cons. So for this one, you're gonna need at least 2 pros and 2 cons. Try to mirror it, keep it a balance. We cannot have 3 cons and then 2 pros, or like 5 pros and then 2 cons. We have to balance it, right? We cannot do more than one or vice versa. Then for this section, I'm gonna give you a little format because sometimes we also have a little trouble with that. So what you can do is you can do pro, con, pro-con, or you can do pro-pro or con-con, right? But in this one, guys, I just want you to keep something in mind. If you do a pro and then a con, I like to call it the two sides of the coin, right? So coins have two sides. And sometimes people come and they say like, oh, I cannot find any con or I cannot have any pro. So what I like to say is like, oh, we're gonna see at the two sides of the coin, right? So for example, let's say your topic is nursing patient ratio. We can look at that, right? One positive side is that a lot of people is gonna get help, but a negative side is that you as nurses are gonna be overworked and you're gonna be burnt out, right? So trying to look at like that. And if you have trouble with that, you can come to our writing center and we can help you kind of like discover and interpret everything. Okay. Then we go into legal and ethical issues, and just like it sounds in this section, we're gonna discuss the legal implications and the ethical implications, right? So for the legal implications, you're gonna describe, you're gonna list legal cases, right? So for example, your topic is, should AI be used in the healthcare setting? Are there any cases already about AI in the healthcare setting? AI is very recent. Do you think there's any? You can list Barrows v. Humana, and this is a case about AI denying a lot of claims. I don't know if you saw it, but there was a moment that like a lot of like insurances were like using AI and they were denying a lot of claims. But how do I know this? It's because I got into the O'Neill Institute Healthcare Litigation Tracker, and this is a great resource. I do a QR code, guys, so you can have it on hand. And they have a lot of topics. They have Medicare Advantage, they have equity, they have reproductive health for those who are doing abortion. So they have a lot of topics, and maybe your topic is over here. So make sure that you give it an eye on that one. Okay. Really? Okay. 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 So for ethical implications, this one is gonna be like, again, you're gonna take out this critical thinker cap, you're gonna put it on, and you're gonna discuss the ethical implications, right? So for example, if your topic is, should couples be able to choose gene traits for embryos via in vitro fertilization? Who has this topic? What are the ethical implications?
Well, I guess it could be religious too, like you can't change things.
Yeah, right. Okay. And then back there, you raise your hand. What is
probably like financial disparages.
Yeah, financial disparities. We can also get into eugenics, right? You know what eugenics is, like the best traits and everything, but who gets to decide this? So this is kind of like a moment where you get like all philosophical and stuff, but also if you have trouble about it, you can cross it already. Okay, then we go into current status. So current status, I need you to do three things. You're gonna put me that today. What is going on today? What is happening? Like regardless of the pros and the cons and the legal issues, what is going on today? And you can be like, today, I don't know, like in vitro fertilization is still not like a well-developed thing, but we're still doing it. Then you can do compare, for example, like abortion, right? Like in some states, abortion is not legal and some it is, or countries. So I don't know if you have the lowering the drinking age number. No, drinking age, no. Okay, that was a topic that we used to have, like lowering the drinking age. And the United States doesn't have much about it, so people will be like, whoa, like I see other countries doing it. Like, can I add it? Of course, like don't limit yourself. You can see into other countries, what are they doing? What can they do? And kind of compare, well, the United States is being here, right? But like in other countries, they're doing that. And then the future. So in here, I'm not asking you like, what is going on? Like, kind of like, ooh. Pero I want to, like, after you read all of this, what do you think? What are the predictions? Do you think it's going to stay as it is? Or do you, and then, not that you think, because this is, remember, all of it is to be impartial. You don't have to put your opinion or everything, but after reading everything, you're going to have like a general idea of what can happen in the future with your issue. Okay. Then we have the role of the healthcare professional. Okay. So in here, you're going to discuss the various roles of the healthcare professionals, and then you're going to need 2 position statements from healthcare organizations. So for the role of the healthcare professional, yes, you're gonna talk about nurses, but you can also talk about like doctors or physical therapists or laboratories. But keep one thing in mind: you're gonna choose the roles that are relevant to your issue topic, right? So, so let's say, for example, your topic is should electronic health record documentation requirements be reduced to allow nurses to spend more time on patient care? What do you think it's involved here? Besides you guys, the doctors, who else? So in this case, they will be, this was a trick question, guys, because this could be like almost everyone, right? So the electronic health records is like your kind of like communication system to be like, oh, this is what is going on with the patient, this is the treatment, blah, blah, blah. So yeah, this was a trick question. Okay, so go, but think about that, like think who is the most relevant to your topic. Then you have two position statements, right? Remember, like Megan said, 2 is the magic number, guys. So for example, so for here, you're gonna relate healthcare organizations that relate to your topic, right? So for example, let's say, should physician-assisted suicide made legal in all states? Who relates to this topic, guys? Oh. Physicians, yes. But for this, we will look for a physician like organization or anything like that. So let's go to the next page. Slide. So in here, I put, you can include a position statement from the Hospice and Palliative Nurses Association. And I found this in the list that the librarian made for you, and we're gonna review that in the research and sources workshop. That is the next workshop. But in here, I want to tell you something. Sometimes when you look for position statements, they don't always come under this name, right? They don't always come like, oh yeah, like physician-assisted suicide. Like, no, it doesn't come like that. It comes about like medical aid in dying or something like that. So make sure that when you're looking for position statements, you keep that in mind. Like it's not always the exact word, but it can vary. Okay. And then at the end, yay, you're gonna talk about your personal insight and conclusion. And guys, this is the only section that you're gonna give your personal opinion. Okay. This is the section where you're gonna like, you have like full liberty. So this is your easiest section. You're gonna reflect what you learned. So of course you're gonna learn new stuff, right? You're gonna research, you're gonna learn stuff, and then your opinion, did your opinion change or did it stay the same? Or what happened? And then at the end, you're gonna have, it says a strong concluding statement. We call it a call for action. But what I want you to know is that at the end, you're gonna leave something to the reader, right? Because there's gonna be someone reading your essay and they're gonna have something to take home, right? Like after all of this, what is the message that you want to leave the reader with? And then now we finish with the outline and we're gonna do the essay basics. Okay, go. This is you guys. You need to write an essay after 2 years. Have you seen this episode, SpongeBob? Yes, you know that, right? You know that's how I felt when I got in the nursing program. I was like, I don't know how to write an essay. I'm dumb. So so I know I get it, guys. I get it. It's like kind of terrifying, but yeah, but you're gonna do it. Okay, go to the next one. So remember, this is a review, guys, because you already know all of this. You took English, like a fuerzas tuvieron que tomar inglés, todos. So think about that, right? Let's take a moment right now to take conscious and be like, I already know this. Like this is somewhere inside my mind. I haven't like burned it like in SpongeBob. It's just somewhere around there. Okay. So the most important thing that you have to keep when writing an essay is your clarity. That's all about it. Like it doesn't matter like if it's a good or bad argument, what I want you to keep in mind is your clarity. And the key to a clarity is to have a well-structured paragraph, right? So we're gonna do a structure for paragraphs. So what is a paragraph, guys? Yeah, yeah, it's a collection of sentences that are meant to like communicate a message effectively, right? So if you don't know this, it doesn't matter, but I want you to keep in mind that one paragraph equals at least 5 sentences. That's the only thing that you need to do. A paragraph is at least 5 sentences. It can be more than 5 sentences, but at least 5 sentences, okay? Okay. So there are 2 types of paragraphs. We're gonna have our introduction paragraph and our body paragraph. So let's go to the introductory paragraph. So when you do your introduction, I want you to think it as a funnel, right? Or they say an inverted triangle. So go. Oh yeah. So this is a funnel, right? Please ignore it. It's not biblically accurate. Pero bueno. So you're gonna start broad, right? Then you're gonna focus more on your topic issue, and you're gonna end with your thesis statement. So let's say, for example, who wants to give me the topic?
Should nurses work more than 40 hours?
Okay, so we can start, right? We can start broad, like nurses do a great job. They always like work long hours. Then we go into more focus, right? Like lately nurses are like, they do 12-hour shifts, but they're wondering like if we want to do more shifts, and there's been like a lot, and I don't know, you can include like, oh, there's been like some hospitals that already do it, some don't. And then at the end, you're gonna be, are we gonna put our position in the thesis there? No, right? Great. Okay, bueno. So for the thesis statement, I'm gonna give you two options, right? Because it's neutral, right? So ever since we started with this paper, like it's been like, how do you do a neutral thesis statement? It's kind of like confusing. So this is the two options that we have, right? So nurses are questioning whether or not they should support the increase in nursing hours, right? Who has another topic?
Opioid is a first-line drug.
Okay, so we can put nurses are wondering whether they should or should not support opioids as the first line of treatment, right? So you just do it like you just insert your issue topic, and we are like, we don't know, maybe we support it, maybe we don't, right? Okay. And then we're gonna go to body paragraph. Okay, go. So body paragraph has three important elements, guys. So I want you to think about that. One is gonna be your topic sentence, your supporting details, and your connection. So go to next. So your topic sentence, guys, is the first sentence of your paragraph. So you're gonna open your paragraph with this sentence, and this sentence is gonna establish what you're gonna be talking about. You cannot be like, oh, apples are great because apples are red, and apples this, and then, but pears are also good, and then apples. No, you're gonna be like apples, 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 and then another paragraph for pears, 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 okay? And I'm gonna give you example at the end. Then we go for the supporting details. So the supporting details is gonna be your evidence, guys. And you're gonna find your evidence through research that we're gonna talk about in the next workshop. But yeah, so this is whatever you're gonna say, this whatever is gonna support your argument. Then go to next one. Then you're gonna have to connect it. You have to give your paragraph a conclusion. It's like, see that paragraph like as a little essay in itself, right? So it has to have a conclusion. You have to tie everything together after presenting all your evidence. And then you're gonna tie it back to your issue topic. Okay, go. So we're gonna make an example here, but remember this is an example, I use fake information. So let's say your topic is, should hospitals be reimbursed based on a pay for performance model. Okay, go. So our topic sentence, pay for performance models can exacerbate health disparities. So this topic sentence indicates that I'm only going to talk about health disparities. And I'm not going to talk about like if they're efficient or if monetarily they're great. No, I'm just going to talk about health disparities. Okay. So for the supporting detail, I put this type of model incentivizes hospitals meeting standards through bonuses. However, Conway and Sacking have shown that hospitals serving patients of lower socioeconomic status are more likely to receive penalties rather than bonuses, right? So I didn't like deviate from everything. I just supported like my thesis statement, right? Like hospitals are like the pay for performance models can incentivize, but like hospitals that serve lower socioeconomic status can like receive more penalties. So you're gonna introduce the evidence and develop it. And then lastly, I'm gonna connect it, right? So pay for performance models can harm hospitals more than support them, especially hospitals serving low patients of lower socioeconomic status, therefore casting a shadow of doubt over this model. So I kind of like concluded the paragraph and I connected back to the thesis statement, right? And this is just an example, guys. You don't have to do it just like this. I feel like this is a bad paragraph for me, but this is just an example, right? Just to make sure that like you stay on topic, that you provide evidence, that you develop it, and then you tie it all at the end and connect it back to your topic issue. Okay. And then raise your hand if you consider yourself a writer. Well, remember, guys, no one is asking you to be a writer. No one is asking you to be a writer. You are nurses. So I already told you, you're already writers. You are gonna write every day. You know how to communicate effectively. And you're critical thinkers. And this is a paper about critical thinking. This is not a topic. This is not an essay for you to demonstrate like your literary capacities or anything like that. No, it's all about critical thinking and effective effectively communicated, right? So don't think about that. Don't think, like, oh my God, I have to write and everything. No, 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 no. Don't think about that. Don't think like this is an essay about like communication, clear communication, and critical thinking. And I'm already both of those, right? Right? Yes. I want a general yes, please. Yes, yes, right? Yes, because you are good. You have done worse things in the nursing program than this. Like you have done IVs, you have been people, you have dealt with terrible people. So you got this, guys. You got this. Don't worry about the paper, okay? Okay, so 22. And then, do you have any questions? Yeah. But now, if you have any questions, you can go to our writing center. You know that. And then, I need you to do a post survey, guys. So if you can go ahead and do it, I would totally appreciate it. Yeah. Thank you. Thank you, guys. Thank you. Have a great day. No, thank you. And if you want to go ahead and grab more cookies, go ahead, or more pretzels. Thank you. Thank you.